Good afternoon, ladies and gentlemen, and welcome to our third day of WEP and third keynote here. We have a very exciting panel for you today, and the moderator for the panel is Dr. Imad Gallouzi. Dr. Imad is a professor of bioscience and the associate director of KAUST Smart Health Initiative. Please join me in welcoming Dr. Imad.
Thank you. Thank you so much. Welcome, everybody. Assalamu alaikum. Really a pleasure to be here and to be in the panel with really my esteemed colleagues and friends. The topic, as announced, is how or where are we in terms of AI assistant for intervention, diagnosis, for neurological development conditions such as autism. So just before we start, I would like imagine the future, in the near future. I'm very hopeful, so it's 5-10 years from now, where we can either at home or we can go to the doctor. We have a newborn or 1 or 2 years old toddler, and we put them in front of a machine, a computer, and that computer then tells us potential challenges that the individual will have. Imagine if that future is become a reality where we can have access to this technology in our homes. Look the impact, how we can predict and design intervention at the early stage of any potential challenges. And of course, neurological and developmental conditions such as autism and others that will be are at the forefront or to benefit from this. We all saw many videos of people with movement disorder for Parkinson where you put some probes and they stop shaking, and the result almost instantaneous, and it's amazing. So can we, or what are we doing on other disorders such as autism? So to discuss this, we have our esteemed panels. We have 4 colleagues. Dr. Muhammad Al-Dusari, he comes from Rochester, from Ohio, Cleveland Clinic. He's a director of neurological program, and he's a physician that deal with autistic patients on a daily basis. Dr. Mahmoud Yamani, he is the head and CEO of Health and Wellness in NEOM. He's a brilliant and well-known neurologist, neurological surgeon. So, and I was told of he has capability, unique capability, golden hands in doing difficult surgery, and we are lucky to have him. Dr. Ahsan Hoque. Ahsan is the chief scientist at SDAIA, who is leading now programs and various programs, AI application in various sectors, including health and neurological disorder in particular, and he's also part of handling or leading SDAIA KAUST Center of Excellence in that area. And Ahsan comes with a world-class background in AI usage in intervention to change, to impact our behavior and in neurological disorders. Ahsan, his PhD from MIT was selected as one of the top or futuristic work that to this day is the foundation for many AI-based design for interventions. Ricardo comes from Duke University more than a year ago. We are lucky to have him. He's associate professor here at KAUST in the bioengineering program and member of Smart Health Initiative. Ricardo has a big expertise in AI in various applications, including health, and we will hear from him. He did work on neurological disorders such as autism. We'll hear from him. So to start, probably to put everybody on the same page, and I know majority of you may know what's autism, but we would like to hear from an expert in a very clear term. Dr. Muhammad, can you remind the audience what is autism and how it's part of these neurological conditions, and what are the state of the art of treatment intervention? What are the issues that related to autism that needs to be solved or being solved using AI assistant.
Okay, thank you very much, Ahmed. Thank you. So I think it's good to talk about autism in the concept of it's a prototype for complex neurological disorders that are prevalent and have a huge impact on society. Autism by definition happens in early childhood, in the first few years of life. It affects social communication. So those kids, the main inability is to communicate with other people, whether for verbal or nonverbal communication, also have issues with social interactions. But their other features is their restricted interest, their repetitive behaviors, their limited imagination. But what we really need to focus on is not one disorder, it's not even a disease, it's a spectrum of many possible presentations. And they have multiple dimensions that are not related to each other. For example, someone could be limited in their communication, but really good in another aspect, such as focusing on numbers and maybe even at a normal or even supernormal ability. So their inabilities or their weaknesses are divergent. They're not in one solid dimension. The prevalence is increasing. So in the US, it's 1 in 36. In the Gulf countries, there was a study a few years ago, 1 in 80. But it's increasing, and the impact is lifelong. The reason to think about this is complex. It doesn't have one single etiology, doesn't have single genes. It has multiple possible etiologies, multiple different presentations. Some of these individuals are not even detected till much later, sometimes in school, sometimes adults, which means that they are really a huge spectrum, which would lead us to, could this be just a neurodiverse rather than abnormal? And that's maybe a discussion we'll have down the road. But the state of the current situation right now is that there are huge demands and limited supply in terms of professionals needed for the diagnosis and for the intervention. And that is our main issue here, that we are using highly demanded manual detection, whether it's interviewing parents, observing these kids in the clinics, but it really is limited in terms of capacity. So expensive, not scalable, and very limited, leading to even the USA a delayed diagnosis. So that there is an average delay of diagnosis of 1 to 3 years from the first concern that parents will bring up, which loses that brain plasticity power that we'll talk about later on, that we would want to diagnose them earlier. So that's the stat, the interventions are even more limited and applied broadly to these kids without sophistication. The possibility for technology is huge, but we'll leave this for maybe the other guest.
So I go to you, Ahsan. From your position now, you have a visibility on what probably there are programs, government programs here in Saudi Arabia to deal with neurological developmental condition, autism and otherwise. What are the various programs that are in place or that will be implemented, and what are the challenges?
Sure, I just want to clarify a dual role. So I am also a professor of computer science at the University of Rochester. So the scientific intuition that I share will come from that role. And from the SADAI role, I'm happy to talk about the government initiative that's already in the public domain. So in 2021, there is an initiative that was announced called Global Capability Development, and that's really towards improving people's well-being throughout the lifespan. And that was part of Vision 2030, started in 2021. And some of the key objective is to how do you enable education for everybody throughout their lifespan, not just during school, but throughout the lifespan. Another objective is to how do you enable parents into the education system. And the one that I'm most excited about is that we need to improve equity and access to education and intervention. And one of the specific KPI on that is We need to improve the number of students with disability enroll in schools and track whether they graduate. So this is already part of the Vision 2030 that's in place. In addition, in February 28th to 29th, there is a conference being planned in Riyadh. It's called Global Talent Capability Initiative, HCA, Human Capability Initiative, under the patronage of Mohammed bin Salman. And the key theme of the conference is exactly what we're discussing. How do you augment human capability? How do you reinvent education, intervention? And how do you bring technology into the fold? So if you're interested in the space, I encourage you to attend the conference. I'm sure there'll be a lot of exciting announcements, initiative will be announced during the conference. So those are the two things I can share for now.
Thank you. Dr. Mahmoud, now NEOM, obviously this is the dream I was talking about. NEOM probably is the opportunity and the project that will achieve many of our dreams, including what I mentioned earlier, that building this capability in terms of AI-assisted technology, machine learning, to really identify, diagnose, or early diagnosis again. What is being done in this space, and what are NEOM's plans to help us probably go more and more in that direction?
Sure. Thank you, Ahmed. Let me start by declaring that I'm not a behavioral scientist. I'm not a smart neurologist. I'm not an AI person. I'm not a genetician. I'm more of the technician for a neurologist, and I'm more of the paper pusher when it comes to creating a system. So I want to put things in perspective, and this is how I see it from a leadership position. We're building a new system. We're building something unique that would help identify problems way before they happen. And the way we look at that is, first of all, mental problems in general, behavioral problems in general, chronic diseases in general. Every disease that is not acquired has some genetic predisposition. Muhammad, correct me if I'm wrong. But it's not purely genetic. And even if it's monogenetic, there is a stimulant to that monogene to start working and start initiating the disease process, and then you see the manifestations. Now, by the time we see the manifestations of disease, the train had left the station. We're already too late. We're working on trying to pull all of these information, all the pieces of the information together very early on. And as Ahmad said, very soon the day will come when, before the child is born, we know their genetic composition. As soon as they're born, we know their environmental compositions. We know their factors in, how, oxygenation, food consumption, drinks, everything that they put that together puts the components of a human being, their life data, their wearables, and so on and so forth. So what happens there is you're actually building on top of the individual gene, the live data, and so you're replicating the human on a platform in the so-called the human digital twin, or the avatar. Now that avatar, with the power of AI, and we're hoping or we're counting on AI reaching that stage, and this would be super AI. It's not the current generative or any limited AI capability that would enable us to compare the factors on every individual to the factors that exist for any disease and do the matching and tell us preemptively what are we going to expect in this individual, whether it's a child or an adult. And how can we work backwards to either prevent or modulate the effect of the disease, the manifestations of the disease. Now, this is about a 5-year work, and I'm happy to announce this, that we are in discussions with KAUST to start this on a partnership with KAUST. And the idea is that if we are able to identify these diseases before they happen, and if we build on AI capabilities to start interventions, then we will solve part of the problem that Muhammad alluded to, which is the lack of capacity to diagnose a lot, the lack of capacity to diagnose early enough, and the lack of capacity to start the interventions. The interventions will have to be modulated according to individual, not according to a disease. And so when you're treating a child with autism or ADHD or learning disability or this or that, just like you're treating a diabetic, basically the interventions are tailored not to the disease, but to the disease in that individual. And this is what's called personalized or hyper-personalized treatment, hyper-personalized intervention. And that is the future, because the response of every individual is different. Now, I'll give you an example. Some people will respond to paracetamol or Panadol, to fever. Others would only respond to Advil. What's the difference? It's the same. I mean, this generic material is the same given to 10 people, 9 out of the 10 respond, 1 does not. Why is that? Because there is something in the composition of that individual that does not respond to this quote-unquote generic treatment, but needs something tailored. I believe, and I could be wrong, that every individual is a different individual. People are not copies of each other. And so to treat 100 autistic children the same way, in my humble opinion, is wrong. We need to individualize it because, as Muhammad said again, one has certain disability, but not in everything. And maybe, in fact, what we can do with the help of AI is unlock their potentials. And these children have huge potentials. If we manage to identify what are they good at, they're not autistic for no reason. There has to be a reason why they became autistic. And I'm sure there is somewhere in that spectrum of intelligence or smart in these children that they are super on one area, and then that is shaded by their overall problem of being autistic. If we manage to identify this problem early on, first of all, we can prevent as many as we can prevent, we can modulate as many as we can modulate, but we can also unlock their potentials in areas that might not have been obvious because of the domination of their clinical status.
So this really, thank you. This is a good segue for Ricardo, from your vantage point and what you already did during your career in terms of study AI-based intervention. What are the areas that AI really now is strong in helping these neurological conditions? What's the state of the art? Where are we now? And what are the challenges that work, like from you and your colleagues similar in the same field, will help us tackle and solve?
Okay, so let me start with a little bit of a disclaimer. I am not an autism expert. My group specializes in general machine learning methodology and applications of such in applications in biology and health. But since about 5 years time, I've been collaborating with a group in the US at Duke University, where I came from, that specializes in autism. And the reason why I got involved is because we are mainly interested in the question of early diagnosis, which is something that Mohammed mentioned before. Before I get into the opportunities for AI, let me tell you a little bit about the challenges, and some of those Mohammed already raised. One of the important challenges is that the prevalence of autism, which is actually a good thing, is very low. It's not good for methodology, but it's good for population health. It's 1 in 36. Another problem that we face is that the presentation of the condition is highly heterogeneous. And the reason why is because it's a spectrum. It's not one thing, which means that we only have a small pool of kids with autism, but they all look fairly different. Another problem is that there's a lot of confounding conditions, both from the perspective of comorbidity and outcomes. For example, about 50% of kids with autism have at least one comorbidity, and about 50%, about Over 95% of kids with autism had at least one comorbidity, and about 50% of kids with autism by the age of 4 will have 4 or more comorbidities, which makes it a lot more difficult to try to build models to do early diagnosis because you don't really know what you are actually trying to predict. Is it that you are predicting autism, or is it ADHD, or motor delay, or language barriers, or is it anxiety? And all this confounded creates a problem for the proper adjudication of kids. So over the last few years, we've been interested in developing machine learning models for early diagnosis, and what we call early diagnosis is essentially before 1 year of age, which is the range of age before other tools for diagnosis are available, things like ENDOS or MCHAC. So we are specifically tailoring those, that period of time. Now, for the opportunities, there are plenty of opportunities for the current advances in machine learning and AI, if you want to call it that way, advances in natural language processing. So we have some work in natural language processing where we are using a text, essentially written language, from both providers and parents as a way to use it to improve the diagnosis of autism. We are also using electronic health records, and for this we are using heavy time series data to try to aid with the early diagnosis and using that sequential information. We are also very interested in disparities in diagnosis. It is well known that the presentation of the condition varies very dramatically across different socioeconomic or demographic groups. So the presentation is not necessarily the same among girls and boys or kids from different racial backgrounds. So you need to also account for it if you want proper early diagnosis, but also if you want equitable diagnosis of the disease to guarantee equitable access to care and to proper therapy. So that's another area in which machine learning in general can provide good methodology to improve the diagnosis of autism.
Thanks, Ricardo. Dr. Mohammed, can you take the current question, please?
Add this to what is the current status of technology in 2024, and how can we build on it, right? So the earlier diagnosis, as we all agreed on, would be advantageous. What we have noticed is that parents notice divergent behavior earlier than physicians, but it's very difficult to replicate in the clinic, right? You bring a child, you push them there in an artificial environment at a specific time, and they may not reflect their reality. So the first piece of technology that was used is just record videos at home and have trained clinicians label this. And then if you label them, they may meet the criteria. The problem, which is good, now we want one step ahead. We went to a naturalistic environment, we went to what parents noticed, but then we created more work for the clinicians. Now they have to sit down, and if you've ever done this, it's painful. Then you talk to computer vision specialists, and they say, we love it, right? You have behaviors that are labeled, and you want the machine to replicate it. They say this piece of cake, right? Then you even add to it the language evaluation and there are multiple systems there, systems that morphed but then joined the same analysis. But it's all naturalistic, and it can detect very early diagnosis. And the nice thing is you accumulate very labeled, very specific information that is digital, right? In addition, it's easier. If you want to do MChat, MChat is the questionnaire or any questionnaire. Why should you bring them in? Can you not just send an app and ask them even very early about even the precursors of diagnosis, right? So you can even do a pre-symptomatic. Like, what does it take for a child to say mama and dada? What does it take for a child to imitate? So the precursor. If the precursors are not there, you can say, just like diabetes, right? They're not diabetic yet, but they may be more likely to develop diabetes. So that's one aspect. The other aspect is eye tracking. and emotional tracking, facial expressions. We all know that part of the essential elements of diagnosis is kids with autism do not pay eye gaze to the social stimuli. So they look at the distractions, they look at the hands, the background. And we as humans are good in detecting this. Machines are even better, right? Because you put them there and you now know that even with webcam, just the regular webcam or the phone cam, it can detect eye tracking. And again, that's work that is mature, but still manualized. So where is the potential for ML is you make it more automated. And in the intervention, I'll just say two things in the current domain, virtual reality, and it's out there now. If you want to train a child for a new situation, for example, this is their first day in KG, or their first flight, or their first encounter with authority, it's risky to really take them there. Can you not do it in a virtual reality that is controlled? And this is out there, it's FDA approved, it's combined with other technology. But, and this is important, but it's still clinician controlled. So the clinician has to be there and see, oh, the child did not react, I'll push this button. Can this be automated? And again, that's your job, right? So this is all the pieces that are there. Social robotics. And social robotics, we and others have worked in this field, amazing. Humans, especially children, are more attracted to robotics, but children with autism more so because they are simplistic, slow, and predictable. And you can use them as a bridge to teach kids imitation, learning, etc. But again, it's still manual. So the potential there is, can you automate it? And there is a huge then spectrum of a lot of emerging technologies, including neuromodulation, non-invasive neuromodulation, including obviously genetics, biomarkers, that will throw in, as Dr. Yamani said, it will throw a slew of information, a huge amount of information, that is beyond human capability.
So this brings me to a question that probably, in my head, listening to all of you, but thinking maybe some of you also in the audience, and please, we will be happy to take one or two questions if there is the audience later on, will give you the chance. Are our doctors trained to use machine learning and AI for all these applications, future applications? If yes, some example will help, but if not, what are the type of plans and programs that will get us there? Mahmoud.
Thank you, Ahmed. Again, machine learning and the use of AI has been proposed for a very simple task, which is reading X-rays. Decades ago. Where do we stand today? It's still not effective, not as effective as it should be. And the reason is the resistance from us healthcare providers, unfortunately, because we are trained in an apprenticeship. So we basically follow our teachers. And if you can imagine that, there isn't any innovation in that. And so we, by default, by nature, by design, name it, reject anything new. And this is what we need to change. And what we need to change is change the way we design healthcare education curricula. Inject some AI in there, inject some engineering, some system engineering, some knowledge outside the traditional healthcare teaching, so that we can prepare the healthcare providers to be receptive of these ideas and then push the boundaries beyond the limits. Because today, that's not what we're doing. And again, the example I gave about radiology, about images, applies to pathology as well. I mean, the pathologist could be at home diagnosing somebody across the globe, but they're just not doing it because they were not brought up to accept new technologies. We need to change that. And how do we change that? We start very early at medical school level, or immediately after medical school, introducing these physicians, nurses, medical technologists to the idea that AI and machine learning can do wonders and actually can close the gap between demand and supply when it comes to healthcare.
So this, Hassan, do you see any challenges? For example, I remember a discussion a few months ago when your first visit to KAUST last year, you were talking about that discussion with FDA and the legislator to accept these approach as standard of care. Where are we there? I mean, whether in Saudi or in the US, I mean, what's the, are there things already approved? Are there challenges?
Right, so before I answer the question, I want to ask one question to the audience, just to get a sense. How many of you have family members with autism in your immediate family or extended? I see a bunch of hands. I just want to, and there's a reason you are here. I just want to empathize with you. I have a brother, 24-year-old. He has autism as well, and I was his primary caregiver for many years. And I know there's a lot of discussion on early screening and diagnosis, and there's a lot of tools being built. But there are a lot of people with that condition already that we need to support for the lifespan. And I think there's a lot of work that needs to be done. So, for example, one of the conditions my brother had was that some conversation skills, like knowing when to stop, not monologue, take interest, ask reciprocal questions, take pauses, something that we all need help with sometimes. And this is
I do, by the way.
We all do. And what if you could use AI to be able to, the virtual avatar who can see you, listen to you, and respond to you in real time, and can perhaps give you some feedback. But that there's also risk to it, because if you build something like this that can have empathy, that can look like human, at some point they may just want to work with that only and not with humans, right? So building, taking some responsibility and building the application is also critical. For example, we worked on building this avatar to help people with job interview, because it's such a 30-minute interview, but it determines your life. And many folks with autism may have a lot of potential, but within the time they're unable to exhibit it, right? If there is a way to be able to help them to exhibit that, that would change their life. And it's not about being friendship or something, it's just a scripted conversation where you do this once and sharpen your skills. So going back to your question, there's a lot of things that AI can do, but the problem is, can we now let it loose in the real world? And if it makes mistakes, who takes the liability? Like when doctors make mistakes, I can go and say, hey, you made a mistake. But when AI makes a mistake, that's a big unknown question. Mm-hmm. Other thing is, let's say, we have a screening platform or algorithm that's out there. Once I tell somebody here, you have this condition, you're going to have trauma right away. Like, well, I have this? What do I do, right? So there has to be resources in place within AI to be able to guide them appropriately to avoid the mental trauma. So there's a lot of work that needs to be done, because we cannot add a 1-800 number where they can call Dr. Mohammed and the question's answered. So how do you instill those things in place so that with that information we can continue to empower them? So FDA is struggling with that too.
So are there the barrier for the legislator to move, let's say, step forward and start implementing some of these of technology?
I think there is an ongoing work on building AI algorithmic code of conduct. Mm-hmm. So US National Academy of Medicine established a committee where they're probing more into it. What should be the code of conduct? And it doesn't have to be one size fits all. Depending on geographical, religion, things should change, and we need to have that flexibility in place. So it's part of ongoing work, and if you're interested in this kind of work, I tell you this is the right time to get into it, because you'll see a lot of resources and funding on this space, because AI is here to stay, and we need to figure this out sooner than later.
So Ricardo, follow up to this, or probably a different twist. Are there AI tools that will, because my understanding, and forgive me to everybody if I misunderstood, that the spectrum like autism, like some other spectrum, is really almost large. You have almost mild or undetectable to very extreme in terms of diagnosis. Are we at the stage where AI can really stratify and rank this and help predict early on?
No. We are definitely not at that stage. We don't really have the power. We don't have the data. We need better sources of data to be able
What
to
type of data that is needed?
No, we need numbers. we need more individuals. So we get more representation of the different subtypes
So is this
in the spectrum.
a call to the audience and everybody, if there are study, please participate?
Basically,
Yeah.
and that also, and another problem is that because you have other coexisting conditions, then you need larger numbers to be able to tease apart the differences, so you can really get to a point where you can personalize the diagnosis, and hopefully then you can personalize treatment and therapy and the long-term support that people need. Because as Essen was saying, you need a long-term support for these individuals, but they all manifest the condition in different ways, so they need different therapy or different support. And we need to be able to detect the type of support they need so we can use the right tool to provide them with the support they need to be able to succeed and thrive in
So
our society.
now I'm not going to choose internet. Please, one, pick this, not controversial, but provocative question. We're talking here now about AI assistance. Are we talking about treatment, meaning cure? Are we talking about prevention? What are we talking about here? Who wants to pick up this?
I can start, and then obviously, I think one concept that even can improve acceptance by families and by professionals is we're not replacing, at least in the short term, replacing the clinicians, right? We're not replacing the human. We're enabling the human interaction. We're making them more accurate, earlier, and more efficient so it can be scalable, right? So when you challenge a clinician, they will say, okay, you are replacing me with a machine. Or a family who will say, I don't want to talk to a chatbot, I want to talk to a human being. But if you introduce it as, oh, these tools are just making your clinician more capable, more efficient, so they can help you even from a distance, more frequently, they can help more people, they can be more scalable, then it reduces that anxiety and resistance, even among that portion. But I think that would be very important to say that we're enabler and we're not replacement of anything. And what we're trying to do is an earlier detection, and maybe, and this is proven by studies, if you do an earlier intervention for the milder, at least, spectrum, you can actually integrate them sooner and maybe even decrease the societal cost and the lost productivity. But if not, then you can hopefully improve their integration. But if not, then that's the element where neurodiversity comes in, right? Where you can have to accept the differences as just different wiring, different ways of learning, and you empower them. You empower their strength, and you support their weaknesses, right? So these are very important, but I strongly believe, and hopefully we share this all, that technology have helped us with so many fields of life, right? From banking to, every other aspects. But we use this, like going to the moon, right? Or a Formula One car. The Formula One car or going to the moon just helps in technology that helps every individual, right? Every car in the world uses some technology that is developed for Formula One. Same thing for going to... So I think NEOM, for example, I'm just teasing you, could develop that really very high ambition and pushing the envelope way forward that even the individual in Tabuk going to their primary care provider can benefit of, right? By early screening, early diagnosis, and intervention. They may not use the exact tool, but they'll use the domain.
So, Mahmoud, are we talking about here prevention? Is it a term that is appropriate for, condition like...
You can't prevent an individual from having a genetic predisposition.
Yeah. So just to be clear, we are not talking about prevention because these are individuals will be born with under a certain personality, but this condition similar to personality. What
with a predisposition.
Yeah,
They're born with a predisposition. So you can't eliminate that. But you can do is you can modify it so it doesn't manifest the full manifestation. And if it does, then you start with the neuroelasticity, trying to bring things back to normal. And if you miss that window, or if you can't do as much, then you do the modulation, and then you capitalize on their capabilities to make them part of the bigger society. But let me go back to a question you asked before. What is holding legislators? Actually, what is holding legislators is providers. If we, the healthcare providers, embrace this, embrace the AI, and accept it as an enabler rather than as a replacement, legislators will follow. Now, the other point about, is this going to replace me? Well, a lot of jobs have been modified by technologies for centuries. When the train came in, people thought they don't need carts anymore. Well, people found other jobs. When the planes came in, they thought we don't need as many ships. When the computers came in, and I remember this, well, not quite as much, but when the computers came in at mass, people thought that a lot of people will be jobless.
Yes.
Unemployment rate hasn't changed much. In fact, has improved over decades. Humans are capable.
So is it probably, and forgive me for this, guys, it's if you are lazy, you will be replaced, regardless whatever technology.
Exactly.
Yeah,
If you're
okay.
lazy, you're replaced. But you can always innovate into something different, something new. And then I guess that was the last point that I wanted to allude to.
So in terms of, I want really, we are at the end of the discussion, I want to leave really kind of a positive message. So, and probably you can start, one of you. Is really the term autism or labeling these disorders, because we are talking about the spectrum, and some of these people who are labeled autistic, but they are brilliant, and we have several examples, geniuses, and really, is it still appropriate? Is it time probably to remove these labels that are with a stigma and replace them with something more inclusive?
That's why we use the term condition. And then we moved from autism and autistic child to autism spectrum disorder and neurodevelopmental condition. Because it's just one condition. It's one type of individual that has certain challenges.
So,
just like some people need glasses and some people need hearing devices.
Exactly. So this is something I want Hassan probably comment as follow-up. We know some autistic geniuses who have autism. It's probably, if we understand by AI assistant how the spectrum works and how the positive aspect being a genius and focus in one area, would that give us a mean to then decide, oh, if I want to create a genius, maybe I will provoke that disease there? Is that?
I wouldn't frame it that way. I mean, we all are unique. We have that unique capability. And I don't think there's one way to be genius. There are many ways you can exhibit. And that's why teamwork is so essential. I mean, I went to a major technical university in the US from a PhD, and there are a lot of people who had autism characteristics. Like, I gave them an undergrad student some task. They would work on the task for like 5 hours. Maybe because they had that innate ability to be able to stay focused and zone out for other things. So people have different ways of doing things. But I have somebody, I need break in every 30 minutes. I cannot do that. So find the right set of people with complementary skills is the way to go. I wouldn't frame it as I need to fix you to make you more genius.
Yeah, thank you. It was designed that you correct me. So we have few minutes. Is there any question from the audience? The mic is there, Katarina.
Hello, everyone. My name is Caterina. I'm not a scientist. I am a mom of a beautiful, fantastic neurodivergent son. I had the pleasure to meet Dr. Al-Dossari in October in Riyadh, where there was an amazing conference about autism. And I was very proud of Saudi Arabia for doing this. And I also know his son for our first meeting when he came in Kaus last year to give an amazing seminar about AI. So I don't have a question, but I have a reflection as a mom. I think that AI and tech will really improve the life of our children. And I can see that in my son. He's really high-tech in everything he does. But also I think that there is an important call for society to change how society sees the spectrum and the neurodivergency. I always tell my son that his neurodivergency is a superpower. It's not a disability at all. His capacity to hyper-focus, as Isan was saying about the people that he met in the university, his ability to hyper-focus and to go deep, deep, deep into a topic, his ability to think outside of the box, and the way he sees the world always fascinates me so much. I'm so proud of him, and I try to empower him in this. Instead, I see that society tries to hide this and perceive the neurodivergency spectrum as something that you should be ashamed of, or that you should hide. And I think that advocacy and self-advocacy, this is what I always teach my son. You need to ask for the things that you need to work and perform in a society that has not been built for neurodivergency. But neurodivergent people exist, and they really can give an amazing contribution to society. So I would like just to give a call to society and to parents not to be ashamed, to come out of their shell, because we are a lot. And now, in this moment, we are very lucky that we can have many tools helping us. And for example, here in KAUST, I know that there are many kids in the spectrum, and we have a center that is, the director is here behind me, for children with special needs, which is doing amazing things. And if you don't know that, you should go and check it out, because it can be really helpful for our children. And also, we need people to start to think that there is nothing normal. Normal is a concept that is obsolete. We have different people, and I always tell my son that his brain just works in a different way. It's not a brain that has problems, it's just different. And actually, I can see that it can be much better than many normal people. So that is just my comment. I don't have a question, but just thank you for doing
Katarina.
this and for talking about autism.
If I can say something, you're
Of
amazing.
course.
And there are lots of parents that we're very fortunate to have who don't feel the negativity. They use this as empowering for their own, family members, for themselves, and for the society. So we really, really appreciate you. And I think you are really the reason for pushing things forward. You are the reason to ground us in reality, right? You're the reason for us to really be hopeful for the future. So thank you.
Thank you.
One point of advocacy, I wanted to add that. Did you go into a technical job interview, anybody? Technical job interview in computer science? It's very intense. Like, you have to shake your hand, squeeze them well, smile, then you're asked to go to the board, write some code. If you don't have the personality, you're going to be weeded out, right? And then that way, companies are missing out on many talented people. So some of the technical companies are now allowing for Zoom interviews where you can turn on the microphone, so not microphone, the camera, so you don't have to show yourself, and you can write code in Google Doc asynchronously. So if you have somebody with that condition, ask for it. Like, I don't want to go through a typical interview. I need this. So if you push for it, the company will provide it. So these are some of the concrete things we can do in terms of making changes.
Paul.
Thank you. Firstly, I wanted to pay tribute to KAUST Smart Health, because about 4 or 5 years ago, when a group of us got together to look at autism and how we could diagnose, we never in a million years imagined that we would have a panel, such a keynote, such prestigious universities and people talking on this very topic. So I really wanted to thank Emed for his vision, for the KAUST Smart Health team for getting this together. My question as a clinician is this, that we all know that early intervention is crucial, but the parents that I meet on a day-to-day basis within KAUST are often afraid of getting the diagnosis because they're afraid it'll affect their children's schooling, they're afraid that it might affect how their child is perceived and so on. So I wanted to just get the wisdom of the panel or any of your ideas on how we can kind of walk with parents on that journey so that they're not afraid of the label, as Emed had mentioned, but that label is actually something empowering that, like Katarina had said, can actually support their child's development in this diverse world that we live in. Thank you.
Anyone wants to take a question? Mahmoud?
I'm actually just thinking of how can we convince parents that their children might need help, but that does not mean that they are not part of the community, that they're not a, let's call it a normal variant of a human being. I mean, we're different colors or different hairstyles or different eyes, shapes, and so are we when it comes to the brain function. And I think a campaign needs to be put in place for something like this, because as everything else, ignorance is the first response to a trauma, and then comes the grieving, and then comes the seeking solution. So we have to kind of shorten that trauma response cycle, and I think the best way to do that would be through education. And who is a better educator than Katrina, talking to the families about this?
Any other comment?
I think there is a perception, right? Families may perceive this as a loss of their child, the loss of, functionality, maybe misconception that could be corrected by education. But then there is a reality, right? If I understand it correctly from you, Paul, yesterday, there is a reality. If you're diagnosing, your child might not be accepted in school. That's a reality. That's not a fear or perception. That has to be regulatory, and so the advocacy to the parents, advocacy to the educators, to regulators, etc. Because it should be a positive enforcer to diagnose early, not a negative enforcer. That's actually what drives the diagnosis in the US to increase, and maybe part of it was exaggerated, because the diagnosis of autism in the US is a positive enforcer of, they will open the doors for a lot of interventions, right? So I think we have to realize that some of it is fear and maybe perception, some of it is reality, right? We have to work on both, and maybe it even exists outside CAUS, right? In other places. I know a child who parent came to me with, I thought they have ADHD, and mom said, no, don't label them because he will be kicked out of school. When I talked to school, I said, the child yesterday is exactly the child that will you see tomorrow. The fact that we diagnosed them with ADHD doesn't make anything. In reality, it wasn't true. The child pushed somebody, and now they said, oh, it's the ADHD. Now he's aggressive, right? So there is reality that we all have to really take responsibility, especially policymakers, right, and regulators, and work all together.
Any other question?
Well, thank you for organizing this panel. This was really interesting. As for the early diagnostics, I have the sense that you are developing some kind of tool. And my question is for Ricardo, is when you said we need more individuals, I'm curious, what kind of data are you looking at? Are you looking at questionnaires? Are you looking at videos? Are you looking at eye movement? What kind of data are you analyzing?
We are using pretty much everything. So in my group, we are not looking at video, but my colleagues at Duke, they are doing what Mohammed was describing with video and images. But really what we need is richer data from individuals in the spectrum. And they don't have to be all diagnosed, but they can have all other conditions, other neurodevelopmental conditions that help us enrich the group of people that are in the spectrum or close to the spectrum to help us differentiate, these different phenotypes or these different presentations of the condition, right?
And how early can this potentially help you diagnose a child?
Well, we are mostly interested in the first year of life because that's the time period in which the existing diagnostic tools do not operate.
Okay.
But obviously, if we had more, if we had information about their parents and the environment, we might be able to start getting ideas a little bit earlier or enriching our ability to make early diagnosis. But that's the best we can hope right now from the early diagnosis perspective. There are other areas of opportunities with long-term support, something like similar to what Essen was saying before.
Okay.
Thank you for the questions.
Yeah.
So we have another question, two questions here, and the last two. Go ahead, please.
The mic.
Oh, okay. Okay, so you talked about how the technology is useful in terms of the social aspects of autism, but I'm curious about how these technologies can be beneficial in terms of other aspects, such as sensory issues or rigid behavior, and if there's any investigation in terms of how that technology can be helpful.
Who wants to?
I think if I get it correctly, you're talking about the sensory difficulties that you have and how technology could help. And that's typically the field of occupational therapy, and they would use sensors, they would use video modulation, they will use a gradual exposure. But the field actually is more mature in communication and imitation more than those fields. Maybe these fields will be the emerging fields, the next fields. So you can see, because autism is such complex and has multiple challenges, we're trying to focus on those that have limited window of development because of brain plasticity. And the most important, probably, is language, social communication, and imitation. Imitation is how we learn. So if you can teach, we all learn all of our stuff by imitation, right? But to your point, that's where current technologies stop, and hopefully emerging technology, especially with sensors, would help.
Thank you.
Last question.
Just firstly, thank you to the panel for a really stimulating discussion. And my question is really, what checks and balances do you think should be in place to prevent AI bias? So we know, for example, the data sets which are used to train algorithms might perpetuate existing biases or social prejudices. So, for example, autism is more likely to be diagnosed in boys 4 times than compared to girls. So just how do we address the subjective realities of life with autism and other mental health conditions?
Thank you. Great question. Hassan.
Thank you for asking that question. This is an existing line of work. There's a lot of checks and balances that are being discussed to put in place. When you collect data, you need to ask the question of what kind of data you're collecting. And then in computer science, usually we build an algorithm, there's a nice curve, and we are happy. We say, okay, let's let it graduate, but then once it goes out, how do you ensure that it's functioning the way it should be? What are the checks and balances you should put in place? There's something called data shift. Like I train the algorithm on certain data, but when in the real world, it's looking at something else that it hasn't seen. But there is no way right now to be able to check for that. That's an open research that people are looking into. But there are existing, a lot of people, legislators are thinking about it. Like that's the hesitation for AI to go out in the real world and graduate just yet because of the issue you brought in.
But I think for closing, that's what Ricardo was advocating. More data will help machine to learn, and more they learn, the machine learn, adapt, and have that stratification and identify and differentiate between boys and girls. This is, yeah.
The person making the question has a good point. The data is biased because it's a reflection of the way clinical practice is conducted and the way that the society works. So from the perspective of the machine learning models, we need to make sure that when we build the models, instead of just striving for performance in early diagnosis, we need to strive for both performance of the early diagnosis, but also equitability in the outcomes or the opportunities. And there are different ways of measuring equity in machine learning models, but we need to make sure that the different subpopulations in a socio demographic pool are well represented in a way that we cannot put some of those groups at disadvantage, either for treatment or for therapy or for diagnosis and stuff.
So with this, I really want to thank you all for your attendance and for the questions, for my colleagues, for great discussions. And I think we all agree that the future is hopeful. Machine learning is here for it to assist us, not to replace. And also, neurological and developmental challenges or conditions are no longer stigma and will be almost like Katarina said, it's empowerment and open new doors that maybe we will explore and see the results in the near future. Thank you all. And last question. Okay.
Yes, since we've been talking about information that is maybe biased, what about genetic testing and what that would involve in terms of having unbiased and maybe more objective data, and what would that imply maybe for machine learning and how it can be developed for something more predictable and maybe even that companies would support?
Part of the makeup of the individuals. The problem that we have right now is that genotyping is not routinely done. And the reason why it's not routinely done is because there is a cost associated with it. So one of the changes in policy, and that's something that's happening, for example, at NEOM, is try to make sure that everyone is genotyped. So if you're a genotype and your parents are genotyped, that makes for a better coverage of the background of the individual and their parents, and then it helps alleviate the bias that comes from the presentation of the individual. You will need to cover the biases associated with the environment using additional data sources, things like socioeconomics, but it will help solve or address some of the biases from the perspective of the individual.
Great question, thank you, and I think can be a topic of another panel for another hour or an hour and a half. Thank you again.